I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. So, in Canada, our healthcare system is far from perfect. But imagine this. You're sick and you need to go to the ED and you get them to scan your United Health card or your Medicaid card or Medicare card, and poof, you've got no coverage. Or, maybe that program that your kids were eating at school, gone. Or, maybe you've been getting tips as a hostess, or you've been working overtime getting that extra cash. You just bought a car with a loan and boom, more taxes. Well, you may not think this will affect you. We've seen this time and time again with the whole leopards ate my face, but these sweeping changes will affect most Americans. So let's specifically talk about health today. Healthcare is political, whether you like it or not, folks. So here we go. So before we get into the episode, I'd like to introduce our guest for today. Dr. Kaveh Hoda is a practicing gastroenterologist with a fervor for science, communication, and skepticism. His ability to demystify complex medical topics and present them in an entertaining manner has made House of Pod a favorite among listeners. Whether addressing medical myths, discussing healthcare policies, or engaging with experts across various fields, Kaveh's blend of expertise and humor ensures each episode is both informative and enjoyable. Welcome to the Gritty Nurse Podcast, Kaveh. How have you been?
I'm doing relatively well, all things considered. I'm glad that, I could come on to your Canada Focus show and be a cautionary tale as to what can happen to your healthcare system.
This is exactly where we're leading, right? We are going to get into that topic of the day, but I think it's really important. So we're going to talk about the big, beautiful bill, or what I call like the big busted bill, the big bill that, is going to destroy a lot of people's lives, the big bill that's going to, people don't understand how badly it's going to affect them. But before we get into that, I think I want people to know a little bit more about you, because you do some pretty dope stuff. So you are a podcasting host yourself. You're also a physician and
correct.
a musician. So
Yeah, I do those things. I only do the physician thing well.
no,
The other things are.
I don't believe that. I have seen some of the clips. I've watched you play. You do a pretty good job.
I will say this: we're better than people expect.
Oh my god!
People come in with low expectations, and I've been playing music for a long time, since college, and our friends would come watch shows, and they would generally leave being a little bit like surprised and say things like, "You guys were good." And at some point,
actually good.
At some point, we were like, "Should we be offended by this?"
I would be
that
offended.
nobody. We would go to music festivals sometimes, and we would arrive, and the band is all, either doctor nerds or computer nerds and people that aren't really cool and hip and don't have tattoos and that sort of thing. And people would assume we were there for like, the AV crew or something. So people were always surprised that we played music. And I guess I like that. I like people having low expectations. It's easy to be a good podcaster in the medical world because people have low expectations of us for that as well. So that is nice. And so I do those things.
Well, you've risen to the occasion, and you continue to shock and surprise people. And I actually ran into this really cool group here in Canada, and I think they actually do some stuff cross states as well, like across with the US folks. It's called Collective Hearts. They're all healthcare providers, nurses, physicians, social workers, and they're all like either musics or artists, or one is an actor, and it's kind of dope. So I went to this showcase that they had, and it was really cool. So like maybe something to come down and play with your band, because they had all sorts of groups there. There were people doing live theater. I think you should join.
We never played outside of California, so going to Canada would be pretty amazing.
To Toronto.
So I would love it. Great city.
Yeah, of course. I'm not biased at all.
Yeah.
But tell my listeners a little bit more about you and your background. So besides the awesome music, what is it that you do? What's your specialty?
So, okay, I'll give the people the whole thing, because why would you know me? There's no reason for them to know me. My name is Kaveh Hoda. I'm a gastroenterologist. So that is a specialist in the GI and the liver and the biliary system. And to do that, at least here, we have to go through internal medicine. And then after that, you do specialty training. So I did that. And I also did a year of chief residency as well during our residency. And I did a year of liver transplant as well. So I did the super duper extra long training. And then So I practice in the San Francisco Bay Area. That's where I do my thing. And
Right.
then I also have this podcast called The House of Pod. It's sort of a relatively informal medical podcast. I think you understand the concept of that.
Yep.
And we look at things happening in the news. We sort of take aim at medical grifters or people in the wellness community, talk about the big, beautiful bill, for example, things that are
Yep.
happening. And, sometimes we'll veer off into things that we just are really interested in. So we'll mostly cover things from a medical perspective. And we try to do it in a way that's really informal and approachable and peels back the curtain on the world of medicine. And my goal is generally I want to have someone there who's an expert, but then someone who's not, who can just help us relate to the audience and help us connect to the audience. So it'll be a musician or a comedian or something like that. And my hope is that we make medicine in general a little bit less scary for
Right.
people that aren't necessarily in it. And people who are interested in it hopefully can hear some voices that seem reasonable and human. I want people to
Human.
hear us like talking like we actually do, not putting on
Right.
the doctor voice.
The doctor voice. It's so important that we have these communities where we have healthcare people, talking, well, not just the jargon, but also, bringing people along the journey, because there has been a lot of mistrust, right? Like
Yeah.
COVID came and just the mistrust went through the roof. And then the other piece is the disinformation. So it's so important that we have your voice and other voices that are out there in the podcasting world, because I think that's the other thing. Like, this is the new media. People are really turning away from, traditional media in terms of trying to get their information from it, because I think, there has been some loss in credibility.
Mhm.
So I think that, it's important that you are in this space. So I'm thankful
Yeah,
for
thank
your
you.
voice.
And same for you.
Yeah, no, thank you. And I think it's important that we do this work. And I love the fact that you bring other people in that aren't experts, that kind of say, hey, maybe I don't understand it. Let me kind of give you my perspective. I think that's actually really beautiful. So I'm going to be listening a little bit more
Please.
to the House of Pod.
Yeah. Hey, all right. I got a listener.
You got
It
you
was
got an
worth it.
extra
All
follow
right.
today.
Yeah, all right.
So unfortunately, the situation that we're talking about today is not very funny. And maybe you can give some context to our Canadian listeners. Like you said, it's a cautionary tale, because I'm sure you've probably heard we have some folks that are trying to defect, some people that are like 51st state. No, it's not going to happen. We're not doing that. But, maybe just giving our Canadian listeners a little bit of a background to what this, I hate it's called this big, beautiful building, because we know it's garbage.
Yeah.
But like, can you give us just a quick overview? I know.
Yeah.
It's a lot, but just an overview of what this bill
No.
entails.
I'm happy to try and do that. Now, this big, beautiful bill, it's this incredibly huge, sweeping tax and spending law that President Trump in the beginning of July put out there. And it touches on almost every aspect of
Right.
domestic policy here, from, I think you touched on it, taxes on tips, to car loans, to giving $150 billion to ICE and
Yeah,
border
military
enforcement.
increased spending. Yeah.
And of course,
Bizarre.
the thing that is concerning mostly to me is that it also includes massive cuts to Medicaid. So the question is, is this going to streamline healthcare, as the people who are proponents of this bill say, or is it going to be terrible, and is it going to make things more difficult for people who need medical care and access, and therefore clogging everything else downstream for everyone else in the country as well who needs medical care? And my thought, you probably can already guess, is that it's a terrible thing.
Right.
And there's a lot of people here who are against this. I am one of them. And the cuts to Medicare, Medicaid, and the changes that are going to happen to loans to people going into medicine. There's so many aspects of this that are going to really hurt, not just immediately, although it will have effects almost immediately. Even though
Right.
the bill doesn't go into effect in a year, lots of places that rely on Medicaid are already acting ahead of time to prepare for
Right.
that. So hospitals are starting to shut down, and that's only going to get worse. And even past that, we're going to see tremendous damage downstream, and that stuff won't be available right away, but it will be within about 10 to 15 years, is my guess. Pretty dramatically terrible. Unfortunately, at that time, Trump won't be in office anymore. They'll have someone else to blame that on, but it's all going to start here. So I am very concerned about what's happening here in this country. We have been for a while, and it's only getting worse. And the big, beautiful bill is really one of the hallmark pieces of terrible legislation that's coming out of this presidency, out of so far one of the worst things to come out of it, in my opinion.
Yeah, I mean, I did some background reading and I was appalled, right? And I think one of the questions that strikes me as someone that's I feel like I'm kind of on the outside looking in. It's kind of like, what does this really say about the state of politics and healthcare and health politics in the US? Like, I mean, it's just so bizarre because again,
You know,
like
a
what would you
lot of
say?
okay, so I'm not going to say that Medicaid was perfect to begin with, and I'm
Right,
not going to say that healthcare in this country was amazing to begin with. We had a lot of
right,
problems,
for sure.
and there it is important to take a look at them and to try and figure out what can we do to fix this, what can we do to streamline it. But this is not doing that. It's the thought that there's people using Medicaid that shouldn't be on it. It's not totally unreasonable, but
Right,
that's not what this bill is going to do. What this bill is going to do is make people who need Medicaid have a much harder time getting it. And it's
right,
just going to make it incrementally difficult along the way for them. There's going to be so many roadblocks along the way, so many requirements, so much extra paperwork. It's the opposite of streamlining. It's just going to make
right,
it so difficult for people who need it to get it. And I don't think it's so, in my opinion, short sighted to see that as benefiting our healthcare overall. No matter at the end of the day what coverage these people get, they still need to get care. That's going to clog up our ERs. It's going to make
right.
it even worse. It's going to make problems that could have been solved earlier and easier solved much later and much more difficult and more expensively. I mean, there's really very little sense to this other than to get the immediate cuts that people want so they don't have to tax billionaires.
Yeah,
That's
I
it
was
might
gonna
be a
say.
it might be oversimplification, but that is, in my opinion, what's happening.
Yeah,
And
I
why I'm
did see
upset.
that. I did see that there's going to be like, of course, the incentive for other people. And we're seeing that again, like, the rich are going to continue to get richer. There's more incentives for them. They're seeing this like increase for military spending. But again, the people who need it the most, and again, I believe that it's that most of the people that are on this specific type of program are low socioeconomic status, are might have other social determinants of health that really affect them, and that's concerning for me as someone who does has done some work in health equity, and we know that these people's their trajectories, their health trajectories are going to be poor, their healthcare outcomes are going
Mhm.
to be poor, and we're going to continue to see you know worse things in terms of their health. But one of the things that I want to ask you is, from your own standpoint as a GI doc, what are some of the things that you might see that would be impacting your ability to provide care, and it kind of maybe immediately and in the long term? Because again, like you said, it's kind of it'll roll out a little bit more starting next year.
Yeah.
But again, you're going to start seeing those ramifications. So what might you see in your own practice?
Well, the first things that are going to happen before people start, missing primary care appointments and
Mm,
screening tests, before that, it's going to be that hospitals that were already working in the margins are going to have to shut down. If
right,
there's not going to be Medicaid payments coming in through them, they're just not going to be able to stay open. That means people in those areas, and ironically, or maybe not. I don't know if I may be like Alanis Morissette and never use the word correctly. The people who are going to be hit the hardest in those areas are also tend to be places that voted for Trump.
right.
So those places are going to get shut down. And if they need a specialist, if they need care, they're going to have to go 2 hours away for that in some places. And that's not, I'm not over exaggerating. That's a kind of a safe estimation for a lot of parts of this country. So that's going to start happening relatively soon. And that's going to have downstream effects on everyone else who is trying to get medical care, whether or not they have coverage or not.
Yeah, see, I scratch my head, right? Because I think to myself, this is actually something that Trump kind of campaigned on. He talked about it. He talked about some of the cuts that would be coming. And it's really, that's why I kind of mentioned this whole like leopards
Yeah.
eating one's face. It's kind of very surprising to me that people still voted in this particular manner, right? Like, I think, again,
Yeah.
when I say like healthcare is political, I think people have to have an understanding of, not just, I'm a Republican, this is the way I voted for
Right.
25 years, but to understand that you need to understand the very specific things that are actually happening, how that might affect you. And I think maybe one of the things that we can kind of discuss too, because again, we'll have a variety, like I do have listeners in the States too, is, we talked about some things that people really truly need to understand, but like, can you pinpoint anything really specific? Like, other than the fact that, yes, it's going to affect certain people, but like, how is it that we get to these folks for them to understand, like, this is what's coming? Because I don't
Yeah.
think,
No, it's a great
truly
question.
don't
How is
think
the
they know.
messaging? No, and I think you're right. And part of what makes this bill so cynical is that most of it doesn't take place until our midterm elections.
Right. It's
So,
wild.
so a lot of people aren't going to feel these effects until they've already voted for other parts of our government to stay in place. And what needs to happen is we do need to hammer this home, like
Right.
repeatedly, time and time again. We need to talk about what's coming down the road. Whether or not they'll believe it or understand it, that's a different question. But in the part of the problem here in the US, I don't think you guys have this same issue there, but correct me if I'm wrong, is our news cycle is constantly changing.
Right.
Like since the big beautiful bill, we've had to do like 3 emergency episodes about other terrible things that have happened since that time. We're not even talking right now about RFK cutting $500 million in funding for mRNA vaccine studies. So
Wild.
it's just constantly changing. And it's hard to stay focused on it, but we do. We need to approach all the things. We could talk about Epstein too. We should.
Right.
We should talk about the vaccines too. We should talk about what's happening in the Middle East too. We need to talk about all these things. But in terms of what affects Americans, I don't think it's impossible to prove to them that this is going to adversely affect them, especially in these communities that are going to have closures of hospitals. I think it's not a popular thing. This was not something that the people pushing it wanted. The people that are behind these things, the Stephen Millers, the Trumps, the JD Vances, the people who are at the top of this chain who want these things done, they're not the people that are out there facing angry constituencies right now. And you are starting to see that town conferences, or they'll have like a representative come and he has to like talk to his like delegates and talk to the people he represents in like Montana. Some of them are starting to show anger about this. This is starting to happen slowly. So we do need to keep it in the public conversation. So I'm glad you're bringing it up. We do need to talk about how rough it's going to be for people. And we have to convince them that even though it may not affect them if they're in those red states, you still should care. Right. You still should care because it will affect everyone in the country at some point.
Yeah, I kind of think to myself about like how we go about messaging, and again, how I think that we could have done a better way of messaging even when it came to COVID-19. Because I'm one of those people that is just like, I want to. Yes, you may have a difference of opinion, you might vote differently than me, but when it comes down to health, like I think we should all be kind of speaking the same language.
Yeah.
So one of the things that I've noticed too, and because you mentioned like it's in the news cycle, to me it's like, I don't know if maybe it's just Canada or other places, but like we're watching like a train wreck, but we're not seeing those town halls. We're not seeing, the only way I get it is from social media that we're seeing, there was a town hall here. These people are protesting. But other than that, it's like radio silence. So we're kind of here in Canada going like, what the hell are you guys doing? We're hearing all this insanity. And we're just like,
we're the crazy neighbors downstairs. I get it. Listen. Yeah. First of all, let me say this. It's hard for me. I am a son of immigrants to this country. And like anybody in that situation, you're almost like a born again zealot for the country. My sense of patriotism is strong.
Right.
And so that being said, it's been very hard. It's been very challenging because it's incredibly embarrassing. And I can only imagine what Canadians really think. And they're very polite, so they won't usually tell me. But I can sense it. And I can't argue. It is a bit bad. I mean, we are a country of extremes, and we do a lot of amazing things, and we do some very terrible things too. And I still believe in the overall arc of this country going the right way.
Right. That's actually really powerful to hear you say, because I would say, well, maybe let me try not to be biased. I probably do listen to a little bit more left leaning media, but again, it's just I think to myself, it's like, I'm glad to hear that, because I think one of the things, like I'm glad that you're patriotic and not nationalistic about it, because I think those two things are very, very different.
Right. It is funny how there's like people who are now openly like white nationalists, and they don't understand that that's not a great thing.
Well, I mean, I'd rather know than not know.
Yeah,
right? Like,
right.
It's like, fine, sure, say that. Now I know where not to put my dollars, where not to like put my energy.
Right.
It's great.
Yeah.
Let them say it, and then again, consequences have like there will be an action. There will be a following action to whatever you say. There are going to be consequences. So I mean,
Absolutely. Yeah.
but yeah, like I think that it's important to be able to be proud of still being an American,
Yeah.
despite all of I'd say insanity that's happening out there. Because again, like it's just like I think to myself, like, oh, if I was out there, how would I get this message across? Because again, like, yes, we have our few folks that are trying to deject, but I don't know if you've probably noticed, Canada has now even become very, very patriotic because of
Yeah.
Donald
Right.
Trump being like,
Yeah.
we're going to
Right.
make you the 51st state. We're like, hell's no.
I'm glad we could help
We
you with
like our
that. I'm glad.
bacon. We like our maple syrup. We don't.
Listen, I'm gonna tell you the truth. Okay, I used to travel the world, and I would always get so pissed off when I'd be like out in Europe or something, and there'd be a group of Canadian kids with their little Canadian flag on their backpack, and I always be like, "Oh, you think you're so much better than us? Oh, look at you, your fancy
Maybe
leaf." I used to get so annoyed, and now I'm like, "Yeah, I get it.
you get it, right?
Now I get it. Now I get it." But to answer your question, there, just so you know, I mean, and so your listeners know, there are a lot of us. We are not a minority, I don't think, in this manner. I mean, I don't consider myself actually far left at all. I feel like I'm a very moderate in the middle guy,
Yeah,
but it feels that's not the case anymore because I feel like things have shifted so far right.
right,
So I don't, so it makes me seem more like it's like our crossfire is like one guy on the far right, hard right fascist, and then one guy in the middle, and then everything to the left of that seems like crazy. So
right.
our
We know
goals
it's
have
a circle at
shifted.
some point, right?
Right. It's all shifted at some point, but I consider myself pretty moderate. But that being said, there's a lot of people who feel like I do. And I would say the majority of people were not interested in these cuts. I'd say the majority of people are opposed to what's happening right now with immigration, and the poll numbers would show that.
Right,
So, what in terms of what's happening and how things have gone, you raised another good question before, which is like the leopards and the faces being eaten. I mean, there is some degree of that where you see
right,
like these like manosphere podcasters come out and they'll say things like, we had no idea he was going to deport the landscapers. And yeah,
right,
my first inclination is to be like, why? How would you not? That's what he
right,
said they would do. That's what Stephen Miller has wanted to do forever. This is like exactly what we all thought was going to happen. There's no surprise so far. My
right,
only thing I'm surprised about is how fast it happened. I
right.
actually thought they were going to start more with like criminals and do that and then slowly work their way down. They just started with like the fruit stand guy day one. So I
Yeah,
am surprised about the rapidity of which it's going down. Um, I don't think it's a good approach for us to be exclusionary and say, no, you can't be part of the cool kids now because
right,
you stood for Trump. We need to have as big a tent as we can. Part of the
right,
problem in this country, and again, I'm a GI doctor and I'm basically a plumber inside the human body and not a political analyst or scientist.
right,
But a big part of the problem we have is that we don't do a good job of including people on the left. The left
right.
fights so much. The left has so much infight because we want to do what's right. And I think in general, we're trying to do the right thing. And because of that, people are going to take the very hard stances on things. And I understand that. But at the same time, part of the reason the people on the right have such a big tent is because there are people there who will back any candidate they have whenever they need to. Now, I also don't want to say we should back terrible candidates on the left because then you get people like Fetterman and you get these terrible people on the left
Right.
who shouldn't be in office anymore. And I don't agree that like we should vote blue no matter who, as the saying
Right.
goes here. But we do need to pull in those people. We do need to listen to people on the far left and see what's working. Why is Zoran Mandami, which you guys may have heard about, the guy who's running for mayor of New York as a
Yes.
Democrat socialist, why is he so popular? Let's listen
Hmm.
and figure that out and let's work with them. And there's some Democrats and some people on the left who get that, like Brad Landers, who was also running for the mayor, more of a centrist Democratic candidate there. He can form a coalition with Mandami. They're doing a good job there. But we need to do that universally in this country. We
Right.
need to pull in more people. And I think we also have to work on some of those people, that we have to get back some of those young white guys that like kind of just went for Trump for a
Yeah.
variety of reasons, a lot of them cultural. I think we can get those people back by presenting good arguments, things that matter to them. Doesn't mean we have to throw trans kids under the bus. I will say that. We can do all these things. We can do them. It's hard, but we can do it. I believe it.
So, what can be done, right? So, how are some of your colleagues responding? Is there anything that can be done at this stage? Nurses, physicians, what is it? How do we pull people in? How do we bring people back, right? I think that was one of the questions I was asking you, like, again, with the social media, like, how do we pull people in? Because I really feel that healthcare, again, should be really non-biased, transparent, like this is how it's going to affect your health, be very, very clear. And I think that it shouldn't matter what our politics are, because at the end of the day, we're going to treat anybody who comes in those doors. But how do we get people to believe that? What can we do? What can a regular person do in terms of all of what's happening right now, in terms of this big bill, in terms of who they might be able to speak to? What would you say to those folks?
It's a good question. It's a bigger question than I'm able to answer. But I will say, from a medical perspective, what we have to do is tell the facts, tell the truth.
Right.
And what I mean by that in particular is we have to fight the revisionist history that happens. And ever since COVID, there's been this revisionist history in this country of like, oh, it wasn't a big deal. It was overblown. It's a lab leak. All this
Right.
stuff. We have to fight those things with the truth and just
Right.
keep going at it. And hopefully what I'm trying to do is do it in like a fun way. So when people listen to the show, they'll hear somebody having on experts who speaks the language of those very smart people, but
Right.
can help translate that into normal English. We all have to do that to some degree. We didn't do a good job in the beginning of COVID. We could have done it. I mean, it's not Fauci's fault. He did a great job. He did what he had to do. He made some mistakes, and as in general, it's not just him, but the medical community, we could have done a better job with some of our messaging. And I think we have learned a couple lessons about what we could do. Unfortunately, we're not in any better place because the people in power have actively dismantled the healthcare infrastructure that we had. And we're actually in a worse place than we were before the pandemic, in case another pandemic comes down the pipeline. But what we can do is we can tell the truth about what happened, what COVID was. That's a very basic stuff. Do not let the revisionist history take over about what really happened. And keep going with that and say, this is what's happening now. This is why mRNA vaccines are important. This is why cutting 40% of the National Institute of Health, their research towards cancer, is a bad idea.
Right.
We have to be able to keep pushing back on these things and explaining to people, because this is for them. This is not for us. And that's going to be hard because the misinformation out there has only gotten worse. And because of that, suspicion towards the medical system has gotten worse too. But I feel like we can fight it just by telling the truth honestly, openly, and in a normal human way, that's the only thing I can think to do to help, is to try and continue to put out good information from trusted sources with evidence-based science behind it, and do it in a way that people can understand. I'm sure there's other things to do. I'm sure there's a Joe Rogan of the left or some shit like that. I'm sorry, can I cuss?
Of course.
A couple times. So they can focus on that stuff too, but that's really what we as medical professionals can do. And to do it in a way that's not judgmental, and it doesn't help us to lord it over people if they voted for Trump. It doesn't help us to exclude people if they're maybe changing their minds about it. We shouldn't do that. We should incorporate them.
Yeah, I agree. Compassion is key, and I think that we need to learn how to have those conversations, right? Even if it makes us uncomfortable, to be like, maybe you had that viewpoint, and you're coming around. So let's talk about it. Let's have a conversation. I think we've really moved away and have lost an art in terms of how to talk to one another. I've seen some conversations that I'm just like, wow, that is like, I can tell you've been on your phone for a very long time. Like, I mean, you just don't know how to speak to people.
It's true. I will say though, I mean, it is hard to have like a debate with someone like RFK Jr. You can't really debate them. They're just going to gish gallop you into submission just by nonsense after nonsense. There is I forget, there's some sort of like Bernoulli's principle or something. Your listeners, I'm sure, know this, but there is this equation, which is basically like the amount of energy it takes to refute bullshit is magnitudes of energy higher than it is just to spew it. And it becomes super hard to do. And it's like, people will give us a hard time if we don't debate, someone out there, but there's really no point in that. So I feel like I'm going to put out the good information. If people have questions about it, I'm usually willing to entertain that. But I don't feel like having debates helps that much in these situations.
Yeah, that Mehdi Hassan situation was a little wild. I was just kind of like,
Oh, the
I
one with
think
like the
that
20, surrounded by 20. Yeah, yeah.
yeah, I'm just like, I don't know if that helped. But
Yeah.
again, like I think I'm a huge proponent of conversations. Again, like I agree with you. There's just certain conversations and or debates, I'd say. Let's stick
Yeah.
to the word debate. That is just like there's no point, right? They're gonna,
Yeah.
like you said, they're gonna use their gobbledygook and they're not gonna put they're gonna just have these
Yeah.
circular, ridiculous arguments that aren't going to go anywhere. So I understand that. And I know there's going to be some people that we can't reach, but for the folks that we can, and again, because I do
Yeah.
have a lot of patients and families that listen as well, is just knowing what they might be able to do. So again, like reach out to your constituents and ask, be like, hey, ask your local politicians, like, tell me a little bit more about this bill. Tell me how this might affect me. I did see a social media video of someone, I think, was it in Missouri? I can't remember. She like cornered some woman and was like, this is how this bill affected my child with cancer. Again, the politicians were pretty cold. And I think that, seeing those types of responses, people are going to really hopefully make different decisions at the midterms. What,
I
what are
mean,
your thoughts?
the only thing we can do is hold people accountable and let them
Mm,
know that they can't just vote lockstep with whatever Trump wants. I think
right.
that is really important. Um, there is discussion to be had about certain parts of pandemic preparedness. I think there is certain discussion to have about, okay, should we when should we close the school, when should we open school?
Mm,
Those things make sense. It's reasonable. Who needs a vaccine, who doesn't need a vaccine? These are again reasonable discussions for virologists, epidemiologists, people who are experts to have. But to just shut off the funding for
yeah.
the mRNA, the one thing that really was good that came out of Trump's in Operation Warp Speed that he did to help develop the vaccines, like the one good thing that came out of it, like to shut that down, that's a simple place to start. It's a simple
Right.
place to start. And talking about Medicaid cuts, a simple place to start. Just focusing on that and how unhelpful that is. The rest of the stuff I'll leave, the Epstein stuff, the ICE stuff, which is all very important. I mean, I will defer that conversation to other political scientists, but what we can do in our world is keep hammering home the importance of how dangerous it is to dismantle our healthcare infrastructure here in this country, not just for us but for the world. And I think that's where I will focus my energy on. I'm trying to at least focus my energy on now, and why I appreciate being able to come on your show and talk about it, because unfortunately, Canada, I'm sorry, our nasty shit is going to eventually affect you if we can't get it under control. So
Yeah.
the more help you want to give us, the better.
Oh no, 100%. And that's where you kind of mentioned at the top of the episode, like that cautionary tale. And again, I want to speak to, our Canadian listeners to be like, hey, it can happen here too. We have politicians who have some of these conversations, talk about more privatization. Cause again, one of the things that it's kind of funny because I don't think we really get it because we have a taxpayer funded healthcare system, so we don't, I will never have to mortgage my house for healthcare, so we don't really fully understand, but we do have our issues here too. But I think we need to be able to see that if this can happen in America, um
Yeah.
it can happen here too,
I will tell
and
you
we don't
that
want it to
it
happen
can
here.
happen here. It can happen anywhere.
If it can happen
So,
there, yeah.
so much, so much that's happened over the last 12 years. There's been so many times along the way where I was just like, that won't happen. It's happening.
Right.
That won't happen. Then it's happening, And now our president is mobilized troops into
In
democratic cities,
right.
to as a show of force. It's stuff I never would have seen happening. It is very disturbing. And again, as a child of immigrants who fled from a country that had strife, it's very strange to see history rhyme like this.
Yeah. Well, you know what? We have work to do. We're doing the work. We're educating and informing. And I think that, like you said, I think we will see our way out of this. It might not be in the immediate 4 years, but I do feel that there will be change and there will be a groundswell. I see it. I see it on social media. I don't see it obviously in traditional media as much, but I know that there are a lot of good people that are saying, "Hey, you know what? What can we do? We're gonna roll our sleeves up too." So here from Canada, I can tell you, I'll roll up my sleeves and come and help.
Mhm.
Because we at the end of the day, we're neighbors.
Yeah.
We're neighbors, and
Yeah.
you guys sneeze and we get a cold. So there's a lot of work that has to be done. And again, I think we can continue to educate them through these types of conversations and podcasts like yours and mine. So,
Yeah.
thank you so much for coming on. I'm sure there's so much more we could talk about, because you know what? You brought, I don't want to go on a tangent, but you brought a point up, particularly because you talk about medical grifters, and maybe mull this over. There's an episode I'd love to do, and maybe you want to be a part of this, where maybe we find someone else, AI medical grifting. So
Oh yeah. Oh yeah. I'm happy to talk about it.
it is
Yeah.
so
Yeah.
scary, where they're like
Yeah.
AI physicians spouting misinformation, but you can't tell, like, and they
Yeah.
have whole channels,
It'll
whole
hallucinate
channels.
whole resources and studies. Yeah, no, it's a very good topic. It's a very big topic. It's something we touched on a little bit on our podcast, and we will continue to as well, because
Yeah, we got to keep
it's
our eye out for
coming no
that
matter
one.
what. Yeah. Yep. Yep.
All
Well,
right.
I would love to come back anytime. We'll talk about that or anything else. It's good for me to meet more Canadians, because
Yes.
one day I may have to flee this country and come up there and practice. So
You
I
come
might
down
be
to
your
my studio in my basement. We'll hide you. Oh
might be
gosh,
your
I hope it
gastroenterologist
never
someday,
would have to
folks.
come to that.
Pretty sure it won't. Pretty sure. Yeah, pretty sure.
Thank you so much for coming on to the Greeners podcast. And I'm sure we'll have more and more conversations. For our listeners, thank you for tuning in and listening, and we'll see you next week. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.